India bears one of the heaviest burdens of cardiovascular disease or CVD globally, with the death rate from CVD being higher than the rest of the world. Shockingly, CVD strikes Indians nearly a decade earlier than Europeans, often during their prime years. Presently, CVDs account for 27% of total deaths in India, with a 12.5% surge in heart attacks in 2022 alone. Alarmingly, 50% of all heart attacks in India occur in men under the age of 50, with 25% striking those under the age of 40. Women are equally vulnerable, with 25% succumbing to cardiac diseases, a significant portion of which even goes undetected. Common risk factors like diabetes, alcohol, smoking, inactive lifestyle, stress, and uncontrolled blood pressure significantly contribute to the prevalence of cardiac diseases. Additionally, sudden cardiac death poses a pressing concern, claiming the lives of seemingly healthy individuals, including younger adults, celebrities, and athletes during routine activities. Addressing this crisis requires urgent action. What steps must we take to foster healthier hearts? Today, we are privileged to have two of the best experts in the field, Dr. Ajit Menon and Dr. Ashish, Contractor, joining us to delve into cardiac care, address concerns, and guide us towards a healthier future. Welcome to the show.
As we're experiencing great prosperity, economic prosperity, also we've tended to become more sedentary.
The first hour after a heart attack is the one that is the most important.
We also tend to store a lot of fat around our waistline, so we sometimes call it the thin fat Indian.
A normal blood pressure is typically 120 over 80.
Doc, I used to smoke 10 cigarettes a day. Now is it okay if I smoke 5? I say it's like asking me, should I jump from the 10th floor of a building or the 5th floor, right?
The other simplest thing that you can do if in a suspected heart attack is get a Disprin tablet, dissolve it in water, and make the person drink that water.
Dr. Menon, I'm going to start with you with a basic question. Why does India have such a high burden of cardiac disease?
I think Indians in general have always had a very high incidence of heart disease. Probably this has also to do with the lifestyle that we lead. It also has to do, sir, with certain genetic issues that are prevalent amongst Indians. And also, to a certain extent, to a surge in various risk factors that we see. Now, if you're looking at the genetic part of it, as Indians, we have a certain issue with our cholesterol levels, where we genetically have a low level of the good cholesterol, which is the HDL cholesterol, and a higher level of the triglycerides, which is another form of fat. And typically the LDL cholesterol, which is the bad cholesterol values, are also on the higher side. So this is a genetic trait which is specific to Indians and to certain South Asian communities. That puts us at a much higher risk of developing coronary disease. Having said that, I think lifestyle also has to do a lot with the sudden surge of heart diseases today, where we see a lot of pressure on youngsters. The living styles have changed. Exercise is not to the extent that we expect people to do. And if you look at the numbers of people who really exercise, it's a very small fraction of the entire population. So it's multifactorial. I think, I'm sure stress and pollution today has a major role to play in the higher incidence of heart disease.
Okay, Dr. Contractor, how does the Indian lifestyle, like Dr. Menon mentioned, how does that contribute to the prevalence of heart disease, and how much of it is genetics?
So, Ekta, over the last few decades, as we're experiencing great prosperity, economic prosperity, also we've tended to become more sedentary. Food habits have changed. There's a lot more processed food that we're all eating. We may call it junk food, we may call it fast food. So those habits have changed from our forefathers, and all of those contribute to the underlying genetic predisposition which Dr. Menon mentioned. We also tend to store a lot of fat around our waistline, so we sometimes call it the thin fat Indian, where overall the person's not heavy, but they store fat around the waistline. So all of these tend to create an atmosphere where we have higher risk of diabetes, heart disease, and all of it tends to happen at a younger age, like you mentioned, a decade earlier than the Western population.
Well, Dr. Menon, there is one misconception in India that when people think that they have a heart problem, it's generally a heart attack. But there is a difference between, say, a cardiac arrest as well as a heart attack. Can you tell us the difference?
Well, a heart attack is actually when the blood supply to the heart muscle stops. Now, the heart is like any other organ. It has blood inside, but it cannot survive with that. There are arteries on the surface of the heart muscle which actually supply blood to the heart muscle per se. So when you have blockages that come inside those arteries, it's basically because of cholesterol deposition. The blood supply to a specific area gets reduced, and because of some certain specific reasons, during an acute episode, the blood supply completely stops, and that gives rise to a heart attack. It's akin to the water supply to your house getting cut off completely. All right? So that's one part of it. So a heart attack is where the muscle gets damaged. It doesn't stop the heart. The heart continues to function, but you get chest pain, you get breathless, you have changes in the ECG which suggest a heart attack, and you go to the hospital and you get treated. The other aspect of it is a cardiac arrest. Cardiac arrest is a stoppage of the electrical impulses in the heart. A heart functions because of certain electrical impulses which are generated by the upper chamber and conducted to the lower chamber, and each impulse gives a pulse. So when you have a stoppage of the electrical impulse, that's when the heart stops. And when the heart stops completely, that's called a cardiac arrest. So these two, though they sound similar, they're completely different. A heart attack is basically a death of a muscle. A cardiac arrest is basically stoppage of the electrical impulses. Now, a heart attack can give rise to a cardiac arrest, but a cardiac arrest is not necessarily because of a heart attack.
So which one is probably treatable more easily?
A heart attack definitely is more treatable. Because then you get time to go to the hospital. There are certain procedures that can be done to treat a heart attack, and the muscle can be salvaged. The most important part is if you have symptoms of a heart attack, get medical help as soon as possible, because there's something called as the golden hour. The first hour after a heart attack is the one that is the most important. If you get treated in that 1 hour, your heart muscle can be salvaged. One thing that I need to stress upon is that heart muscle is one of the muscles in the body, but once it is injured, it never recovers. So time is of essence when treating a heart attack. A cardiac arrest survival depends upon what happens and who witnesses the heart attack. Now, if it is witnessed by someone and someone starts a CPR on the spot, the chances of survival are much higher than if you just wait and look around and wait for an ambulance to come. So there are certain CPR modules which are available in the city today. There are the AED machines, which are defibrillator machines placed in certain places, which help a common man to treat a cardiac arrest on the road if it is witnessed.
And how does one diagnose it? What are the symptoms? When should one see a doctor?
I think, again, coming to these two different conditions, if you have chest pain on exertion, if you get jaw pain on exertion, you have a typical constriction in the center of the chest or in the throat on walking, and that radiates to either the jaw or to both the hands or on one side. Or if you have any breathlessness, which is undue, which you didn't have earlier, and you're getting breathless on walking. Or another odd symptom is you get up in the middle of the night feeling breathless. You have to sit up. You feel better on sitting up. The moment you lie down back again, you start feeling breathless again. Now, these are typically cardiac symptoms. If you get any of these symptoms, get examined, visit your doctor, get your routine checkups done, and a physician should be able to tell you whether these symptoms are cardiac or non-cardiac.
Okay, but uncontrolled blood pressure, I think that's one of the key problems. 1 in 4 people suffer from uncontrolled blood pressure in India. How does one resolve it? What are the key symptoms to watch out for? What are the key readings? How often should one probably take their blood pressure? What would you recommend to somebody?
Well, the only issue that we have with recording blood pressures at home is that we have to use electronic monitors, and there's a certain way of recording the blood pressure. Now, what symptoms do people have when they develop a blood pressure? A lot of patients do not have any symptoms whatsoever. It's only when you go to a doctor for a routine examination and you check the blood pressures that you realize that the blood pressures are on the higher side. Some of the symptoms could be, again, breathlessness, frequent headaches, waking up with a headache in the early in the morning, or late evening headaches as you finish work, because typically the blood pressure tends to rise at two times. One is early in the morning because of the circadian rhythm of certain hormones, and one is in the evening after your stress levels are pretty high, your work is over. That's when the blood pressure starts to rise. In terms of how do we come to check it, the best, if you have a family history of blood pressure, it's always better to keep a check on your pressures once in a while, at least once in a couple of months. Keep a random check on your blood pressures. It will tell you whether the blood pressures are normal or not. Now, that brings us to the question, what is a normal blood pressure? A normal blood pressure is typically 120 over 80. There was a perception that beyond the age of 60, you can still have slightly higher blood pressures, but that conception is no longer valid. And I think we need to still keep our blood pressure around 120 to 130 on the top and below 80 on the bottom.
What about risk factors such as alcohol, smoking, and stress? Stress, I mean that, it probably results in other factors or habits which could result in possible risk factors increasing. So alcohol as well as smoking and stress.
Okay, so let's address all three sort of separately. The first one is easy, smoking. So when we talk about lifestyle modification, we always talk about being moderate. But this is one area where it needs to be zero. So smoking, tobacco consumption, including vaping, which especially the youngsters are into these days.
So vaping is a big risk.
Absolutely, and that needs to be zero. There is no moderation. Sometimes patient asks, doc, I used to smoke 10 cigarettes a day. Now is it okay if I smoke 5? I say it's like asking me, should I jump from the 10th floor of a building or the 5th floor, right? So the answer is no. Smoking has got to be zero. Then we come to alcohol. Now, this is where it gets interesting because kind of for a long, long time, even the Heart Association recommendations were that moderate alcohol is not bad for your health, red wine is good for your health. But keep in mind that a lot of these studies were also sponsored by red wine growing countries. And today, the research has shown is, ironically, that even a little bit of alcohol is not necessarily good for you. So I have a simple line for my patients. I will never encourage anyone to start drinking, right, for heart health. If they are drinking and they're doing so in moderation, and we need to define moderation, then I would allow them, but certainly not to start drinking. Your last point was stress. Now, stress and heart disease has a sort of a bi-directional relationship. As you said, one is the indirect effect of stress. Because someone is stressed, they may say, oh, I need to smoke, I need to have a drink, I don't have time to exercise, right? So that's an indirect. But we know that there are direct effects of stress on the heart due to the hormones kind of release. So we know that stress can lead to heart disease, stress, anxiety, depression. And heart disease itself can also lead to things like anxiety, depression, and stress. The only problem with stress is we cannot measure it. Like he said, we can tell you your pressure should be 120/80. We can say your fasting sugar should be below 100. But there's no number to stress, right? You're a financial channel. So if a white-collar worker suddenly sees the Sensex drop, his stress level is going to go through the roof. But the blue-collar worker, it's not going to affect him. But if the blue-collar worker loses a 100-rupee note on the way to work, it might affect him much more, than his boss might. So stress we cannot measure, but we definitely know that it's not good for your overall health and heart health and needs to be kept under control.
Managing stress is a whole different conversation.
But if I may add here,
yes.
Stress, I agree with what Dr. Ashish said, that stress is a non-quantifiable risk factor. It's not the stress that matters. It's the reaction to stress that matters. There are certain people who can take stress and react to it very differently. There are certain people who react to it in an absolutely negative manner also. So that reaction to stress is what releases the hormones, and that's where it has a direct effect on the heart and other organs.
Okay, well, that's a very important point to note, that it is your reaction to stress. And yes, stress is not quantifiable, but don't pick up that cigarette, don't smoke that vape, or don't pick up that drink in a reaction to it. We'll take a break, be back with more questions.